Hello and welcome to this video on spinal cord research, which I hope you'll find interesting. So what do we mean by a spinal cord injury? Well, you can see on this image an oval shape which represents the injury to the spinal cord. In the grey matter of the spinal cord, around the grey matter is the white matter, and at the top and bottom you have the membranes which surround the spinal cord. The particular aspect of spinal cord injury which I'll be discussing in this video is to do with electric fields. Now, it has been known for quite a long time that electric fields can improve certain outcomes in a spinal cord injury. Two types of electric fields have been investigated, or rather two different types of pulse mechanisms, and the first type of pulse that was investigated was short microsecond pulses. It was found that these short pulses could bridge a gap in the spinal cord injury and carry a signal from the periphery of the body to the brain. In other words, there was a certain amount of sensory information that could be fed back to the brain. Now, this type of signalling has a number of terms, but for the purpose of this video it's called neuromodulation. So neuromodulation involved short microsecond pulses to bridge across a spinal cord injury. However, that particular type of signal is not the subject of this video. The subject of this video is the second type of signal that was or has been investigated, and that is low frequency pulses or long duration pulses. Early work showed that these types of pulses, when applied across spinal cord injury, could promote axon generation or growth, and furthermore it was shown that the degeneration of axons within the injury was greatly reduced. So we had what seemed to be very useful outcomes: axon growth and the fall in the rate of degeneration. So this was all very good, but as usual some problems emerged. Before discussing those problems, let's talk about the research in a bit more detail. Well, that early research used probes which were placed above the dura mater. The dura mater is one of the membranes that line the spinal cord, and the probes were sutured into muscle fibres above the dura mater. Now, the probes, of course, would have a current going through them, and that would produce an electric field which would penetrate into the spinal cord to impact the injury. And what they found was that the electric field, as I said, promoted axon growth and reduced degeneration of axons. Two problems emerged. The first problem was that the location of these probes meant that in order to get a sufficiently large electric field into the spinal cord injury, they had to use quite large currents. The second problem that arose was that to do with the probes themselves. Now, the probes they used in the early research were made of platinum, and what they found was that the platinum over time would degrade. Now, this will cause toxic factors to get into the body under test, so of course that is not desirable. So whilst there was potential in that early research, the problems were probably at the time insurpassable, and so the research tended to be put onto the back burner. The work I describe in this video seems to have got around those two problems, as we'll see in a few seconds. So on this second image, this simple image, you can see at the top the probes were placed above the duramator, and they found, as I mentioned, that this required quite large currents. So the research which has just been carried out this year, or at least published this year, relocated the probes to below the duramator, as shown at the bottom of this diagram. The second problem related to the degrading of the probes, the platinum probes. The research seems to have got around that problem by using a different type of material. Now, the material they have used is iridium oxide. Now, the iridium oxide was put onto platinum probes by a sputtering process, and the group have referred to these type of probes as sputtered iridium oxide probes. They use the acronym SIROF. Now, the earlier work that I referred to, where the probes were above the duramator, used initially a direct current. Now, this found that axons would only grow towards the cathode end of the signal pathway. It was then found that by changing the polarity, alternating the polarity, plus minus, etc., if you like, an AC signal, it was found that the axons would grow not just at the cathode but also at the anode. So the work I'm discussing in this video used a 2 Hz reversing polarity signal. The work was carried out on rats. So how was the spinal cord injury induced? If you're of a nervous disposition, you might want to skip this part of the video. The rat was sedated, then the spine was cut into, the bony structures were removed of the vertebra to expose the spinal cord, and an injury was induced in the spinal cord by an impact process. The group used a impactor which had a tip of 2.5 millimeters diameter, and the force it applied through that tip was 1.75 newtons, which is quite a significant force. It was quite a major injury which these rats were given. So what was the advantage of these iridium oxide probes? Well, earlier on I talked about the second problem where platinum probes degraded and became toxic. So the group obviously had to show that their material was not toxic and did not degrade. And that is what this final slide is covering. So they tested both platinum and platinum coated probes. Their probes were platinum coated with iridium oxide. So they tested both these types of probe in phosphate buffered saline. Now, phosphate buffered saline, they say, represents, or very closely represents, the electrical characteristics of the spinal cord fluid. So in this diagram you could see the setup. The probes were put into a column, jar, with phosphate buffered saline immerged in it. They then applied the signal which they carried out the research on the rats with. That's in the top left hand corner, and you can see it's 5 microamp signal, which is quite small, so they're getting quite a response for quite a small current. Furthermore, that current is changing polarity. In other words, it's going from +5 to -5 amps. And what they found was that after they had tested their probes for 90 days, there was a significant difference. What they found was that the platinum probes had completely degraded, but their probes, which were platinum coated with iridium oxide, had not degraded. So the summary of their research is can be summarized that by relocating the probes below the dura mater, in other words subdural, and by using a different type of probe material, the outcomes in terms of spinal cord injury can be greatly improved. Now, of course, these are just carried out on rats, and it may be a good few years before these techniques are applied to actual human patients, but hopefully in the long run spinal cord injuries will be improved by these 2 simple changes. Well, I say simple, but advances in technology. Anyway, thank you for watching this video. I hope you enjoyed it.